This segment is sponsored by PrimaryOne Health.
And it is Marketplace Health Time. The mission of PrimaryOne Health is to serve the Central Ohio community with affordable, easy-to-access healthcare services. And here to help us today unravel some of the confusion, and there could be some, over healthcare is Charlita B. DeVeris, and she is the PrimaryOne CEO. And with us today, do you like that I put B in there?
I do, because that recognizes my maiden name.
There you have it. So good to see you again.
Good to see you too.
Tell us the mission of PrimaryOne.
Well, PrimaryOne Health's mission is to serve those who are experiencing any kind of challenge, financial, social, or cultural barriers to health care. We want to ensure that everyone has high quality health care.
And how, aside from shows like this, which help, how do you reach those pockets of people to get this information out there?
Well, we have what are called community health outreach workers.
Nice.
That they do events, they go to other people's events, and then we have various partnership events at PrimaryOne Health so that we can provide information about who we are, what we do, and what services we provide.
Do you have any idea of what numbers would be underinsured or uninsured?
We were told here in Franklin County, out of those individuals in our county, 200% and below of the poverty level, about 14% are being served by what's called federally qualified health centers like PrimaryOne Health. We have several 100,000 people in Franklin County that are still not served by a primary care provider.
Wow.
Many uninsured, and then in other cases, individuals who could be insured, but they just don't have the insurance coverage.
If you're sitting at home and you're watching and you're saying, okay, I pay premiums, how does this work for somebody who doesn't have the possibility or capability of doing that?
Well, if they're below a certain income level, they could be eligible for the Medicaid, the straight Medicaid, or the expansion, which was done to cover more people, up to 138% of the poverty level.
Right.
And that was done so that more of our residents would have coverage throughout the year for health care, rather than sporadic care or just showing up at the emergency room.
Right, and what a difference that does make.
It made a huge difference, not only for the health and well-being of that individual, but the health of our overall community, and certainly for those of us who care for people who are uninsured. PrimaryOne Health sees everybody, whether they have insurance or not. It changes our bottom line. There are more people that are covered, which means we can serve more people who are uninsured.
Don't you feel like the trickle down too? A lot of people don't look at it for what this is really doing as the tentacles spread out throughout a community. If you start with just basic health, people are really truly going to be able to pull themselves up in other areas.
Absolutely, Sean. In fact, I've coined a phrase, if we don't have our health, we can't be ready to learn or ready to earn.
Yeah.
That's so fundamental to everything else that we do.
That's so good. Now tell us when this enrollment period runs.
Well, open enrollment starts November the 1st and it goes through December 15th. These are the periods of time every year that individuals can enroll in the open market exchange. Private insurance.
Okay, so get to it today. You're hearing the hope that's coming from, of course, Charlita Tavares and so many others. And PrimaryOne wants to help you with all of that. Thank you. So good to see you always.
Good to see you too, and thank you very much.
You bet. So if you have questions too, give the certified application counselors a call at any one of PrimaryOne Health's 10 health center locations. The number to call, 614-645-5500. That's anytime between 8 a.m. and 7 p.m. during this year's open enrollment period. And thank you for all the information.